All right, we are live. Welcome, Dr. Singh. Thank you so much for being here today.
I'm happy to be
Um,
here.
we have you as our first guest during MHAM 2025. And for those of you who are new to American Migraine Foundation, MHAM is when we bring awareness for Headache and Migraine Awareness Month, the whole month of June. But you may recognize that it's actually still May. And so we felt like it was important for us to kick off MHAM a little early this year and really bring to light mental health and how it plays in brain as well. So, welcome, Dr. Singh. You came highly recommended to do this talk today. Will you just quickly introduce yourself and tell people who you are?
Absolutely. So, my name's Betsy Seng. I'm a clinical health psychologist by training, and I'm a professor of neurology at the Albert Einstein College of Medicine and health psychology at Yeshiva University in the Bronx in New York. When most of what I do every day is training clinical psychologists and medical residents and fellows to work in headache medicine and conducting clinical trials to evaluate behavior change for people with migraine and other headache disorders.
Well, I think that that really tells us there's no reason for you not to do this talk. It's clear why people said, "Hey, she's going to be part of this." And you all forgive me. I'm doing a little tech support too, so I'm going to be watching the chat for questions. So as I'm going back and forth, forgive me for double duty in today. But also, while we're talking today, if folks want to put comments in the chat, we're happy to refer to those if we get to them. If we can't, we'll try to see if we can circle back at another time as well. Um, Talk a little bit about why is it important to bring to light mental health along with migraine?
So I think that it's so lovely that AMF is considering highlighting mental health this week because mental health is such an important part of taking care of ourselves when we have any chronic disease.
Yeah.
Living with migraine is a really stressful experience. People with migraine have these unpredictable episodic attacks of neurologic symptoms. And whenever you have a presentation like that, where the symptoms come and they go, or they get worse or they don't, um, it can really make you worry. What am I doing? What am I doing wrong? How do I stop this? And that presentation in particular, it just can be very, very challenging for anybody to deal with, but especially for people who may already have an underlying predisposition towards depression or anxiety. So I think it's really important that we try to take care of ourselves so that we can make the best decisions in the moment, to take our medication, to use our device, to talk to our neurologist if things are getting worse. Mental health challenges can make all of those things more difficult. So I think it's important to remember that part of taking care of your migraine is also taking care of yourself. Because if you're not in a good place to be making decisions for yourself, if you're struggling to do the things that you know help you feel better for your migraine management is going to suffer.
Yeah. Oh, that's so well said. So, if somebody's watching and they're struggling and they're like, "Gosh, I'm already out of work because I'm having headache episodes or I'm having, other things go on, and then I feel bad that I'm on top of that. I'm struggling with anxiety, and that's feeding that, and then I'm also struggling with depression. What's kind of, I love that you just said, take a look at that and take note of that. Is there thoughts on how someone can take that and know what to do with it? Like, what do they do about that? Like, what do
So,
you tackle first, I guess, is the real question.
well, so I was going to say, so what you're really asking is this question, what do you tackle first?
Yeah.
And I want to hit this head on, and we've done some research on this. So, for a long time, there was this sense that if people's migraine disease wasn't getting better and they're struggling with depression or they're struggling with anxiety too, people would say, well, they have to get their depression under control and
Mm,
before I can really work on their migraine, or oh, they have to get their anxiety under control before I work on their migraine. That's not true. So, for every person with migraine, we want to really emphasize prevention to get you down to 4 or fewer migraine days per month, and then acute treatment to treat the attacks that are happening. And if we're not at that point, it's important to continue to engage with your neurologist, with your other healthcare professionals, to try new things, try different things, try combinations, because living with migraine is very challenging and it is hard to manage to get down to that level for many people. So I want to give people with migraine who may also have mental health comorbidities permission to continue to
Yes.
bother your doctors to be able to achieve the kind of treatment response that we hope that most people with migraine will be able to achieve.
Yeah.
Um, Recognizing that it's not possible for everybody, but we have to stay engaged with our neurologists. That being said, when you have, I want to take them one by one. When you have depression and you're also dealing with migraine, there are a lot of hallmark features of depression that make managing migraine harder. People with depression often have a difficult time with what psychologists call behavioral activation. That basically means getting out of bed and doing things.
Yeah.
Getting out of bed and doing things is one of the most helpful things that we can do for our brain health, for our physical health, as well as for our mental health. So when we have depression, it can make it harder to advocate for ourselves with our doctor. It can make it harder to get out of bed and do the things that we need to do. It can make it harder to sleep and to keep a routine circadian rhythm, like daily schedule. That's really important for people with migraine, is getting up at the same time, eating at the same time, exercising at the same time, just having a kind of a consistent routine to our day.
Yeah.
So having unmanaged depression can interfere with the things that we do to manage migraine. So we really want to also treat depression at the same time if that's something you're struggling with.
Yeah.
Anxiety is a little bit different, but the message is the same. So anxiety can interfere with migraine management in a couple of different ways, and it just kind of depends on which way you land. But when you have anxiety and you're worried, um, for some people, that worry leads them to overtreat, to take early, to take often, to then potentially run out of the most effective medications and be left with things that aren't as effective later, or to use way too much over-the-counter medication, which can cause a secondary headache, medication overuse headache. We typically ask people not to take more than 15 days per month of simple analgesics, 10 days a month of combination analgesics, even things you find at the grocery store.
Right.
So anxiety can lead to overtreatment, which has its own cascade of problems. You run out of the good things, you're left with the things that don't work as well.
Sure. Sure.
Or it can lead, for many people who come through my lab, can lead to undertreatment. It can lead to fear. Well, oh my God, what if I do the wrong thing? I don't want to put things in my body. We want people to be able to recognize migraine symptoms and treat effectively when they're happening.
Mm-hmm.
So anxiety can interfere with that. And that's another good reason to not wait to treat your anxiety until your migraine gets better, but to recognize that we should be focusing on both at the same time. Well, at the same time, avoiding the trap of, well, when your anxiety improves, your migraine will get better. So we're not going to deal with your migraine.
Yeah. Sure.
Treat your
Sure.
migraine, but also treat your mental health.
Sure. Well, and it's interesting because from just my short time at AMF, I've heard people say, like, gosh, I just feel guilty. I feel guilty that I'm already having pain and I'm having the phase before and the phase after. And I'm already out of work. And now I'm going to say I've got depression or anxiety or anything else. And one of the things I love about what you said is that this is real. This
Yeah.
is if someone's watching who may be a caregiver and they're just like, I don't know how else to help or I don't know what else to do. I love that we first and foremost just want to stop and acknowledge that these are real symptoms. These are not made up. These are not a way to get out of things if there's employers watching who say, oh, my employee misses work or whatever. But I love that statement of just acknowledging this is real. And we hear it from people. And you obviously have spent quite a bit of your life working and studying this.
Yeah, the migraine is a brain disease. And there is a really pernicious history of people treating migraine as though it is under our own control. And I have a little theory that may help people, understand why. So my theory is that most people don't experience migraine. Migraine is experienced by a subset of the population, right? About 1 in 5 every year. But everybody has headaches. So when do most people get their headaches? Like when does a person without migraine get a headache?
Mm.
Well, they get a headache from caffeine withdrawal and they get a headache from alcohol withdrawal, hangover. So for many people, the only experience they have with headache is much, much milder, no associated symptoms, and connected to their own, directly connected to their own behavior, and
Yeah.
behavior that for some
Mm.
people at least holds a little bit of a moral, aspect.
Interesting.
Migraine disease does not have any of those characteristics, right? This is a um, brain disease where people's brains are more sensitive or more aware and reactive to changes in their environment. And yes, for some people, those changes in their environment is coffee and alcohol, but most of the time it's like the weather, one's,
Right.
hormonal cycle. These are not things that you have a lot of control over.
Right.
Um,
Right.
so migraine is inherently less under one's personal control and has no moral characteristics, even if one were to ascribe them to it. But I
Mm.
think that most people experience headache in that context. So there's this underlying prejudice that leads to stigma in society about migraine.
Wow. Wow. What an interesting idea.
You add mental health to this, which is stigmatized on its own. And
Right.
of course you have people feeling guilty. And the core of guilt in migraine disease, as well as in mental health problems, is this sense that I should do better. I should be different.
Mm.
That indicates that you believe that you in some way caused this to happen to you.
Mm.
And one message I would love for people with migraine watching, as well as caregivers, to take away is that people with migraine did not cause this. They don't
Mm.
cause the symptoms, they didn't cause the disease, and that this is a disease that needs to be managed. Just like epilepsy is a disease that needs to be managed, just like diabetes is a disease that needs to be managed, migraine is a disease that needs to be managed. So my cognitive behavioral therapy tip for patients who are struggling with guilt, and this is common in people who experience depression, is that when you hear those shoulds in your head, I shouldn't have done that. I should have known better than to try to drink that glass of wine. I should.
Mm.
You switch it and you say, well, what is it that you want? What is it that you want? So I shouldn't have had that glass of wine last night. Now I have a migraine attack. Can be translated to, I wanted to be able to celebrate my niece's wedding. And that is a value to me. And I'm glad that I was able to celebrate with her. And
Mm.
right now I need to go find my medication because I need to
I
deal with
love
my
that.
migraine attack.
I love that.
Yeah.
Yes. Yes. You're bringing up so many valuable things, and especially people who may be recently diagnosed and, they're trying to make sense of it. And, I was one of the guilty people coming into this role before I got this role and saying, I had no idea how debilitating it is. And
Yeah.
even simply learning things like the verbiage and saying it's migraine and it's not I have migraines.
Mhm.
It is the condition. And so
Yes.
understanding that this is something that you battle constantly and it's not a one-time event, and in line with what you're saying, just all makes so much sense. Talk a little bit about you have kind of really committed your life to studying this.
Yeah.
And I guess this also goes to our thought thinking of hope. But how are some of the things you're researching possibly going to impact people's lives? Like, talk a little bit about that because I don't think people always go, "Oh, wow, someone's studying this and working on this in the background." Talk about that. That's fascinating.
So it is every person with migraine eats. Every person with migraine has to sleep sometime. And every person with migraine moves their body. And every person with migraine thinks and has relationships with other people. Many people with migraine have very legitimate questions that say, it seems like when I change these things, that changes my symptoms.
Hmm.
And we are in the absolute infancy of truly understanding how and why changing our behavior changes our neurochemistry in such a way that it can increase or decrease migraine activity. So, the things that my lab and labs like mine are interested in understanding is not just, well, there's an association between this, skipping meals is a great one. There's an association between skipping meals and migraine attacks. So the recommendation right now, which is a recommendation I give people all the time, but the recommendation right now is to eat consistent meals, eat small, consistent meals throughout the day. Don't skip meals. And, we come up with a lot of rationale for why that might be true. But nobody's done a clinical trial of meal skipping versus not meal skipping. And there are a lot of reasons why people with migraine might skip meals on a day when they have a migraine attack or on the day before a migraine attack, which, as you mentioned, this is the prodromal period. It may be that you're nauseated and don't want to eat, or that you took a nap to treat your migraine disease
Mm.
and it appears that you skipped a meal, but what really happened was you were asleep. It could be that one of your prodromal symptoms is, situational anorexia, is not feeling hungry. Um, there are a lot of reasons why it might be the other direction. So we need clinical trials, which is the major thing that I want to do to evaluate these behavior change strategies that we're recommending to people with migraine, because some of them may be wrong. The other thing to know is that different strategies probably work for different people. Migraine is not migraine is not migraine. And that is especially true when it comes to prodromal symptoms, postdromal symptoms, interictal symptoms, and behaviors. So for some people, migraine is an all day, everyday thing. And even if they appear to have attacks, if you looked at a headache diary, if
Mhm.
you ask them, has there ever been a time in the last 6 months you weren't sensitive to light? They say, gosh, no, I'm always sensitive to light.
Right.
Their brain is always in this migraine looking state.
Mm.
Whereas for other people, they're going through life with no apparent migraine symptoms, at least none that they notice. And then all of a sudden, bam, the attack comes and all of the symptoms hit them at once. Those are different things.
Yeah.
And that's going to hit you differently. And it maybe should impact the decisions that we make about behavior change, how you use your medications. One of the things I'm very interested in is helping people take their medications early so that they can reduce how much disability each attack gives them. So,
Yeah.
so
Yeah.
those are the kinds of things that we're interested in understanding. And taking it back to mental health, you can see how everything that we just talked about would be made harder by depression or anxiety or other mental
Absolutely.
health concerns. You can also see, though, thinking back through everything I just said, migraine is not a mental health condition, right? All of the things that I said are relevant to every human being who experiences migraine. Everyone eats, everyone sleeps, everyone thinks, everyone has relationships. If we can find ways to live that can help us manage our migraine better, wouldn't that be great?
Mm. I love that. I love that. And I love that you have, and on behalf of all the patients, thank you. Thank you for having this passion for migraine, because I don't think it still blows my mind how populated the world is of migraine patients, and that we still have so many people who don't understand it and
Yeah.
who don't raise their hand because they're like, I don't think people really understand. This is not just a headache.
Yeah.
Um,
Yeah.
so
People
that's
with migraine
amazing.
are the most resilient people I've ever met. So, when I got into the field because I wanted to study pain, because I felt like people with pain are marginalized in the hospital
Mm,
and in the healthcare system. Somebody shows up and they're like, I'm sorry, doc, I still have pain. And everybody's kind of like, can you just pretend you don't? Right. So I thought that was fascinating and I wanted to help people with
sure.
pain. But when I met people with migraine, I said, oh my gosh, it happens all the time. I'll get a referral from a neurologist and they say, so and so needs help with stress management. And I meet this person. You have never met someone so good at stress management
They don't realize
as
it.
someone with chronic migraine
Mm,
because they know that stress matters. So, stress is an autonomic response to perceived dangers in our environment. All of us have it. It's the reason why we're able to stop the car quickly when the kid runs in front of us in the road. Okay. It's a good thing. If we didn't have
right,
this, things would have been bad.
right.
So, it's a good thing. It's protective. But when it's turned on all the time, it's bad for migraine. Okay. So, people with especially long-standing high frequency episodic or chronic migraine, they're like the best stressed managers in the world because they know
Interesting.
how much it matters. They've been trying to deal with this for years. Many times clinically, I look at people and I'm like, I can help with a couple tools you may not have tried, but like you have migraine. I don't have to sell stress on you. You're already doing it.
So are you saying, Dr. Singh, that migraine could be their superpower? Is that what?
There is a whole line of public health messaging, a wonderful video that won the award at AHS a number of years ago that described migraine as a superpower. And I think that's relevant to talk about just for a minute, because migraine is a superpower in many of the same ways you can think of anxiety as a superpower. So it is a
Mm,
little bit related to mental health awareness. The core feature of migraine is a core feature is an increased awareness of what's going on around you,
mm,
and your brain reacts to that. So um, you're a little bit of the canary in the coal mine. The things that seem to precipitate migraine attacks are things that are likely not very helpful for the regulation of any human brain. No brain loves to sit under sun glare all
right,
afternoon. We're all sitting
right,
through graduations right now, right?
right.
This is not a fun time. Nobody likes to go without water for hours. No brains like that.
Right.
People with migraines have a brain with migraine disease have a brain that is just more aware of those changes
Mm,
in homeostatic balance and um, things that make the world a better place for people with migraine disease make the world a better place for all of us.
mm,
So things like having free and easy access to water, things like the ability to turn down those fluorescent lights, things like being able to take breaks when you need to, or being able to work at home flexibly when you feel unwell. Those are things that improve quality of life for every
yeah,
human brain.
yeah.
But they're things that people who are living with migraine find particularly helpful. So I like to think about migraine as a model disease that kind of describes the way that the entire world could be made better for
Mm,
everyone's brain.
wow, that gives us a really big job. So now we're everyone's brain we've got to work on.
Well,
No,
yeah,
no,
yeah.
I
And
that's
it's not on
amazing.
people with migraine to make those changes
Yeah,
at
yeah,
all. And you should always consider what the extent to which you feel comfortable advocating for yourself in various
absolutely.
environments. But a lot of the work that I've participated in has been around trying to help people refine their language and
Mm,
assert themselves in workplace and in social and family situations because um, you have a real disease and you deserve accommodations
mm.
and those accommodations would actually make life better for everybody else too.
Yeah, I love that. I love that. And yeah, I think you're giving people probably yes, I get that. I hear that. I feel that. And I can imagine people who are watching now or watch later will say, someone's hearing me, someone's seeing me. One of the things we are our theme for this month is really making sure people know that they're visible. They're visible with an invisible disease because we heard so many people say you can't see it. Sometimes it's frustrating. You can't see it like you can other illnesses. I mean, you may be able to see someone squinting in their eyes, or you may be able to see, a look of pain, but that we want to make this more visible and help people understand that the reality of this. For people who are watching, and I know we've got to close up, but for people who are watching who are taking care of someone, and I don't mean taking care of bedside necessarily, but maybe your partner, your spouse, maybe your employer, employee, whoever is struggling with migraine, what could they do? Looking at the mental health side of things, what could they do to support their mental health
Yeah.
with such a diagnosis?
One of the biggest things that people with migraine need is flexibility. And
Mm,
that is also true for people with mental health conditions. So one of the biggest ways that family members and employers and coworkers can help support people who have migraine and especially people who are also struggling with mental health challenges is to provide flexibility when it is at all possible. Um, People with migraine will move heaven and earth to get their tasks done, but sometimes they can't. They will move heaven and earth to make it to the niece's wedding, but sometimes they can't. And um, the reality is that caring for your migraine disease has to take priority in most cases because if you can treat early and treat effectively, you'll be back in a
Mm.
couple of hours. You'll be back the next day. Whereas if you push and push and push and push and continue to let the symptoms progress, you're really expanding the amount of time that you will not be able to give to
Wow,
your health.
that's powerful to remind people because I'm sure there's that piece of pushing yourself and trying to get through it, and you see all the task ahead of you. And what a great reminder for caregivers that if they can stand by or take charge for a minute and let their loved one step back, rest, relax, get through this period, they'll recover quicker, is what I'm hearing you say, possibly.
Yeah. This is certainly true for episodic migraine. For chronic migraine, this is Mental Health Awareness Month. I want to just make sure that I give a shout out to all of those caregivers who are caring
Mm.
for people who
Hmm.
experience really substantial disability related to their migraine disease or to the comorbidities with other health conditions, potentially
Yeah,
mental health conditions. That caregiving is an Olympic sport,
yeah,
and it's a marathon, and it can be very difficult. And there is a ton of literature, right, that shows really the potential for negative mental health impacts of caregiving. So I would strongly encourage caregivers to have at least a social support group, if not their own therapist. And here is why. It's
love
called the
that.
onion theory. So when you're in the center of the onion and the bad thing is happening to you, in an onion theory, support goes in, complaining goes out. Okay. So
Mm.
when you're the person with migraine, you're the middle of the onion. Support should just go in. Your partner ideally should not be spending a lot of time complaining to you about how difficult it is to rearrange their schedule to make the son's basketball game
Mm.
because you got a migraine attack, right?
Mm.
It's you should be providing support in, and you should be complaining out. So
Mm.
that means that the person with migraine is in the middle. Your caregiver is in the very next part of the onion. So you need to have somebody to complain out
Right,
to. It
right,
shouldn't be the person on the inside, it needs to be somebody on the outside.
right.
So seeking your own social support network of people who do not need to provide caregiving to the same person
Yeah.
is really, really essential. And that's one of the really good things that all of these social support groups can do. It's also something that a trivia night can do, or, a beer night, like great. And therapists are also there to help.
Yeah. Oh, what a good reminder. Because for those of you who don't know, we have the Move Against Migraine support page as ours. It's not glaringly that it's AMF's because when we did this, the idea was really just to make sure people know that our desire was to have a support surrounding them. And that group has grown exponentially on Facebook. And we have people that are caregivers, we have patients, we have caregivers that are grandma, grandpa, cousins, aunts, uncles saying, help me.
Yeah.
And sometimes it's a cry for help, and sometimes it's I'm tired. I'm
Yes.
tired. I don't know what to do. And so I love that. And there are tons of different types of support groups locally, whether it's in your community center or church or a therapist or your hospital or whatever else. But that is so important because that person could burn out. And I am so sure that migraine patient, is going, I wish I could take in all the criticism. I wish I could just change the schedule
Yes.
and go to the baseball game.
Yeah.
Yeah,
Of course. Don't you, the person with migraine would definitely rather be at the baseball game than
100%.
throwing up in their bed. Like
100%.
100%. So
Yeah.
people share the same desires, but there is an optimal way for the social structure to work. And people who are caregivers need to be able to complain out. They
Yes.
need another layer of the onion. They cannot
So
do it alone.
good. That's so good. Well, thank you so much. Do you have any closing words of hope or of encouragement as people are going through this week and just looking for that little bit of hope?
Yeah, I just want to remind every person with migraine who's listening that migraine is not your fault. It is not your fault. But that doesn't mean that there aren't things that we can do that will help you feel better. So my hope is that you feel empowered to continue to engage with your neurologist, even if it feels like things have not been working, to continue to engage with your neurologist or to find a neurologist who will work with you on your migraine disease because you can absolutely feel better. And also to recognize that this is a long haul, and that mental health is important. It is just as important as your migraine disease, because when we neglect our mental health, we're really limiting our resources to manage migraine. So if you are feeling like seeking out some mental health care might be a good thing,
Yeah.
do seek
Yeah.
out a therapist in your area, find a counselor, go to your church and find, or synagogue, find resources. There are lots and lots of resources. Seek help before it's an emergency
Yeah.
because you may be able to find a lot of resources that can help you avert a mental health crisis.
Yes.
Having, feeling not great while dealing with a chronic disease is normal,
Yeah.
and
Yeah.
you need support while you're doing it.
That's so well said. Dr. Singh, thank you. We really wanted to kick off MHAM early because of the importance of mental health, and I couldn't think of a better way to do it. So thank you so much. For those of you who are watching, the recording will be on Facebook, and then we'll also upload these as well to our YouTube page. Um, we have so much valuable information that's coming in the next few weeks, and many talks like this. For those who maybe haven't seen our e-blast, every week's going to be a different theme. And so just follow us along on Facebook. Also, we also have e-news if you want, and you want to get our e-news. You can also go to our webpage. At the very bottom, there's a place to subscribe to our e-news that talks about the different themes and the speakers. So we just thank you. Thank you, thank you, thank you. We're going to have Dr. Richard Lipton on Friday talk about migraine and depression, and looking forward to that as well. Yes. But thank you for taking the time, and thank you for your passion and love for our patients too. So and just keep sharing with others this week about all that's going on, and we want to just keep pressing forward as a community. It's going to take all of us, right, to rally. So thank you. And for those who we didn't get to your questions, put them in the chat. We'll see if we can answer them. If not, we'll see if Dr. Singh can later, and we'll regroup. So thank you everybody for watching, and we'll see you for our next segment on Friday. All right, take care.